All right, welcome everyone to our maternal health innovation community of practice with CityGate Dream Center today. So as we get started today, I'm going to first ask for any attendee information. This is to help us with reporting for our quarterly and annual reporting, and also just so that we kind of get some feedback on the session. Then I'll turn it to CityGate Dream Center to do the presentation about connecting community partners to really get to know CityGate Dream Center, get to know their community and their work and their passion for helping new moms and new families, and also just better serving Spanish-speaking communities and better serving new families and new moms. And then at the end, we'll do some Q&A. We can ask questions to Pastor Lisa and Amelia Suarez. We can ask them some questions about their work. And then we will end with some updates, and also be sure to fill out our evaluation form, especially going into year 4 with community of practice. We don't have the lineup yet, and during our next office hour, we're hoping to get some feedback on topics and people and organizations we want to hear from. So definitely filling out the evaluation form will be helpful, so we can think about what to do in year 4. Remember that you can always rewatch sessions. This one's also being recorded. It's going to be found on newmomhealth.com. We have a hub for MHI for this work. It includes the community of practice recordings. It includes upcoming community of practices. You can also find information about our program and about our toolkit there. So here is where we'll just take a moment to do the attendee information. And Ketchy, if you wouldn't mind putting it in the chat. I think you already did. Thank you so much. And also you can use your phone your phone camera to scan the QR code. While I have you, and while you may have your phone out, I'm also just going to show the evaluation form so you can have that pulled up as we go. Before we get started, I'll remind you at the end. And with that, I want to introduce Pastor Lisa and Amelia Suarez. They are part of the CityGate Dream Center here in Burlington. They are our community partner. They are wonderful partners in this work, and I'm going to turn it to them.
Well, we're really excited to be with you today. This is Amelia.
Hi,
I'm Lisa, and we want to just start off by showing you a little bit about our center, and then a little bit of our history, and then Amelia is going to share more about how she's building a beautiful village with our moms in our community. So I'm going to go ahead and share my screen. Is that right? All right, we'll start with this video here. Presentation.
Music. Donuts on the beat. Donuts on the beat.
Okay.
All right. So that's just a little bit about, you get to see some of the beautiful faces that we have. This is, we started as an outreach arm of our church, of CityGate Church, and began by, no, I just keep showing. Sorry, a little technical difficulties here.
We can hear on.
We can hear you. Yeah, you sound great.
Okay.
Okay.
Great. Sounds great.
I'm having trouble advancing our slide, but I'll keep talking until we get it going here. So my background is I was a student pastor for a little over 30 years, and just love working with students and love giving them an opportunity to see that they have so much to offer to others, and love having that opportunity. So, so we're paused somewhere.
Pause the sharing.
Impact on our community. So we started by adopting Andrews Elementary and started doing things on campus with them, celebrations for them, snack packs, Christmas gifts, and then also started doing things in the neighborhoods, like driving through and giving away fresh fruit or Gatorade, and doing little block parties out there, teddy bears at Christmas, and a lot of different things that we were able to do just out in the community. And then in 2014, we had our first camp at Andrews and had about 150 kids, and just completely fell in love and knew that we can't just visit here, we've got to live here. Our church is about 15 minutes on the other side of town, and we really wanted to make an investment here. So we started looking for a place that we could have, and we moved into our first building in 2015. It was kind of like used to be an AutoZone or something like that. So it was a cool building, and from the first day, it just was filled with so many different people and families, and just love having that opportunity. So we did camps and student programs and dance classes, and our first partners along with Andrews was Lupe, which is a Latino organization, Cone Health. We started doing like breast cancer awareness things. They were paying for us to do Zumba classes. The Burlington Police Department would come and just hang out with our students, play ball with them, do different things with them, play cards. And the city of Burlington really got behind us too to help us. And so we moved into our current location in 2017. And that's when we applied for our 501c3 status. So just from the beginning of everything we've done here, we've really been able to build relationships with kids, a lot of kids that we've known since second grade. Actually, the group that just graduated this year, we've known since second grade. So one of those students interned with us this year, and it's just awesome to be able to have, to be a part of a community for long enough to really build relationships and get to see, you know, people be able to use their gifts also. So now when we do our camps, this summer we did 4 camps, and I think we're a little over ambitious because we didn't get to do many the last couple of years, but we did 4 this summer, and most of our leaders are students from the area. Many of them are ones that were with us when they were growing up. So this is kind of what we did pre-COVID. This is kind of what we look like. We had student programs for about 150 students every week. We did monthly family gatherings. We did fun things that we could do together and have a meal together, computer classes, English classes, GED classes. We did a lot of different camps and life skills and a whole lot of different things. But then when COVID closed us down, like everybody else, we were like, wow, could we at least maybe do something for the families, for their students that were coming? And so we started thinking of what we could do. And so right at that time, I got a $10,000 anonymous donation. And I was like, okay. I was watching the LA Dream Center and they were doing a drive-through meal distribution. So I thought we could do this. So the first week we came out and we just put it out to a little remind me system that we had for our students. And the first week we gave away 500 meals. And it was a pretty incredible thing. So I'm going to show you real quick about that. So with that, doing the meal distributions, like you saw there, close to $90,000 came in to be able to purchase food from small area restaurants and food trucks. And then we found a lot of individuals at home that would love to have a food business, but they just don't have access to being able to do that. So we purchased food from some of them. Also, people would just line up and drive through, and like everyone else, most other nonprofits were kind of restricted in what they could do. So we had people here, about over 50 volunteers every week, almost every other nonprofit in the area coming alongside of us and helping. The president of Elon University, the mayor, the police chief, like everyone around came in and to be a part of that. We also, during that, in a meeting I wasn't in, they were meeting about the North Carolina Diaper Bank wanted to start having a spot here, an open place during COVID to distribute diapers. And someone who was in that meeting said, I bet the Dream Center would do it. So they called us and said, would you guys mind like giving away pallets and pallets of diapers every month? And we said, we can do it. So we started doing that with them. We also had opportunities for the city to give away emergency assistance. We did census outreach, food distribution, anything that we could do to go out in the community and be able to share encouragement with people. And then in the fall that year, we became a learning pod site. So we had about 50 students here every day. That seemed like that would be easy, right? Because they're just, we're not the teachers, we'll just be, but it was a lot. But we did that for most of that year. And then as soon as we stopped that, the FEMA and Cone Health and the state had all come around and asked us if we would be a FEMA site for the vaccine clinic. So we got to do that for 7 weeks and see close to 4,000 people get their vaccines here. With the diaper bank, we became getting to be the location for the diaper bank. In that year, they had 5 emergency locations, and that's what we were. And we gave away 380,408 products. That was a value of $129,000 as an emergency site. They had 5 sites, and what we distributed here was more than all the other sites combined. So over 3,000 families that we got to serve with that. So we wanted to be able to continue that. There we go. So that's a little picture of the FEMA site that we were. And actually the FEMA site is significant because that's when we got to hire Amelia and have her join our team. So we provided translation for everyone, and it was really an incredible opportunity there. This is just a little picture of one of our winning teams from one of our tournaments. With soccer, we have, this last year we had 2 men's leagues of 8 teams each, a women's league, 160 kids in our kids leagues, and also a youth league. Actually, one of the guys in this picture started a U14, wanted to do a travel team. So they had tryouts and they picked a team and went to the regional tournament, and they actually won. So they're going to Florida to be a part of that. This is just a little glimpse of what we do now. I won't go through all of those things, but as you can see, our dream is really for our community to thrive in every area. So we're never going to be done. We're always going to keep adding things. And the wonderful thing being in the position that we're in now is that many people come to us with ideas, people from our community. You know, we say the Dream Center for 2 reasons. We want people to have a dream bigger than what they might see around them. And second, that we want to be able to be a launching pad for people's dreams. So many people from our community want to come. One of the other young men wanted to start a wrestling program. He just had his opening day with that last week. Just a lot of different things. Actually, Amelia and a couple other people came and wanted to start a women's empowerment, and that's what the Women of Tomorrow is. So just a whole lot of different things that we get to have. I did just want to share this with you because statistics can be deceiving. You might look up Alamance or Burlington, and you might see there's a 20% Latinx Hispanic population. But if you go to the schools right around us, and this is actually from a couple years ago, so it's a little higher now, almost all of our schools are a little over half. Some of them, Andrews is at 60%, and I think Cummings is up almost to that now too. 60% of those students are Latinx students and families. So I'm gonna let you see a short video with Amelia, and then she's gonna take over for us.
Hola, soy Emilia Suárez del Dream Center, soy educadora de salud y una de mis misiones aquí es ayudar a la distribución de pañales y productos femeninos. También te puedo ayudar en diferentes áreas de salud si lo necesitas. Eres siempre bienvenido.
And I'm the congregational nurse at the Dream Center. We are handing out diapers right now for those who are in need. Come visit us every first Thursday of every month.
Oh yeah, we continue to chat. Hi, how are you? You know who I am now. I'm Emilia Suarez. I want to tell something about me. I moved to Burlington maybe 2 years ago. Yeah, I have the opportunity to volunteer here. So when I come in here, I fell in love in this center. I have a very good connection with the community. Yeah, I really enjoy what I do. Thank you. Oh yeah, we continue. Okay, so this is my search about to the fourth trimester. So you can see what I do, and you can see on in the last video you can see how I reached to the women's. We have a lot of people coming. They know a lot to the Dream Center. So when we do into the diaper distribution, we get that information. They coming to see more about to the fourth trimester. So this is the pace. Sometimes I do this is the width of the pace. So this is look like what I do when the mother's coming. This is I told the ladies. And this is the one. I do a lot of focus group, but this is one specific. I have the opportunity to show to the ladies how they can go to the internet to find this information. Here I have it. You know, the mothers coming, and I tell the pictures. I tell to the web, the page. And they sit down and told too many histories about her and her families. Yeah, I can continue. Conclusion. So you can see, I found a couple of things. Yeah, I put in the presentation is the mothers not having access to the internet or don't have computers in the house. So this is a no good situation for them, but they come in here and we give to the opportunity to learn how handle or how use the computer. Yeah, I think this is it. Yeah.
Amelia, do you want to share some of the stories you shared with our team about just about some of the mothers, about the ways that you recruited mothers,
Yeah.
and just some of the stories about, like you said, about the computers, about you know, you said a mother talking to you about using her son's computer, or things that you know about your community.
Okay, the histories. Okay, I have too many histories, but a couple of touch my heart is like in May when I have a meeting with a lady. She came and sit down with me, and I told to the pace and everything and explain. She's new in the area. She's pregnant. I give the information. So when I do this one, you know, she go have the baby. I think she's so busy. 2 weeks ago, she came and said, look, my baby. So that doing my day, you know, that is so, wow. That told me that I said to her, it's important. Yeah, I help with something to her, you know. So she's coming and say, look, Emily, my baby. And she presented the baby to me. So I'm so happy. So happy. This is one. The other with the computer, you said that you asked about the computer is Dream Center thinking and everything. So we have here Mondays in the morning, we start to the computer class. You can help me with that, the computer class.
Yeah, so it's a digital literacy class, and it's in cooperation with another agency, and they come and do classes, and when they pass the test, they get a laptop. So we've had probably 15 ladies get to go through and get a laptop to have at home, and then he continues to do more of an advanced class too. And then we have other classes here too, but our dream is to have Actually, the room we're in is kind of, we want to have as a cyber cafe. So people, if they don't have a computer at home, they could come use one of our computers or just use the Wi-Fi. So just a lot of things like that. I think Amelia said too that she thought it would be great if some of the things could be on YouTube or different things that she could share too with moms.
Yeah, the other thing, they come into here to bring the keys. I see they doing a question. I go read.
Okay, we can do questions after.
Oh yeah, they coming to bring the big kids to play. Yeah, I said they have the baby. I say, how old is your baby? It's have it 2 months. I say, oh, I have information for you. So I take it to my office. I sit down. So that lady tell the other lady, and she said, oh, my cousin can come in. She's pregnant. Yes, coming. So this is look like, you know, every family is here told what's going on, the good things. So they come in, hey, I can come in, and they come in pregnant. You know, somebody tell me you can give me good information or you can help me. I say, yes, come on. So all time you see everybody say, what are you doing with the mothers? I see everybody coming with the baby, talk to you. I said, and they see me all the time I doing the meetings or something. So this is the way I see somebody as the way I recruit 72 mothers. The other way is when we give the diaper distribution, you know, we give the information, look, we have a one page. If you can do it in your house, coming here, we can explain. At least sometime we give to the diaper distribution one time in the month. So perfect, we have 150, 200 cars that days and the family is coming, look, you have it. So if you see in the video, we give the information, what do we have, what are we doing? I may have to have a question. Let me see.
And everyone, feel free if you have questions you want to ask about, you know, how they were testing the postpartum materials, the toolkit, newmomhealth.com and saludmadre.com, or just more in general about, you know, how Amelia was able to create this village of mothers that, like she said, became this strong community that was, you know, many of them were pregnant and then came back to say, like, with the new lens, I have, you know, an update on what I think about your postpartum materials now that I'm in it. So that's really cool that they were able to and still continue to stay engaged. Amelia, would you share more about, you know, you were telling me how, you know, your approach to inviting the mothers in, and how you kind of created that village. Can you share more about how you did that?
I don't hear one word. You say invite. You say invite. I'm sorry.
Yeah, like your approach to how you invited them in. You were sharing with me yesterday how, you know, how the approach was so important.
Okay, how I imitate, you know, I tell you how I doing it when I doing the direct distribution. But when the ladies coming here, or I go and somewhere I see somebody pregnant, hey, I have this, I create a little page, a little card. So we get, hey, we have information for you. I'm gonna put the card here. We have information, is good for you, or we have something to give to you to help a lot with the baby, when you have the baby or you prepare it. Oh, well, I'm asking sometimes, are you ready for the baby? What are you preparing? And they said to me, no, I have just only the diapers, I have the clothing and the milk and the baron. I say, oh, but you know, what about your families who care about you other kids? Or, oh, I'm not thinking that. So when this is my way to start to promotion to the page. Other way is when the people, I tell you that they know I am doing this one, so everybody communicate, say, hey, Emily have information, Emily have information, because I walk in all area. You see how big is this area here? So all time, this is the way I do it. I love talk to the people. You can see, you know, I talk a lot.
So pretty much any time that there are people here, Amelia's trying to connect people. So she's a great bridge builder, whatever it is that they need and what she finds out. She also, we do big clothing and food and meal distributions and furniture, all those kind of things, and Amelia kind of oversees that too and gets people connected. But she has a passion for people and just does such a great job connecting people. So because we've been in the same community so long, like we've got some deep roots here, and it's been really great to continue to see that. A couple years ago when we started the soccer, and we got to hire a couple of Latinx Hispanic guys that were on our staff, that helped build. We weren't reaching dads before that, but now we have a lot of dads coming out, and they're coaching and in charge of so many different things and doing so many different things, and started women's leagues. And Amelia's just finding so many different ways to connect moms, and just hearing what the other awesome thing is. There's so many other places like Cone Health or the state or the library or the Boys and Girls Club. We partner with probably like 30 other organizations. So we don't have to be the experts on everything. If there are other people that love our community too, then we want to partner with them here.
I see somebody doing it. You can read.
Yeah. So Jessica Johnson, she used to work here at our health department, and it was her dream to start the diaper bank. And they, with their team, like got diapers donated and got us started even before our connection with the North Carolina Diaper Bank. They had like a diaper shower, and big loads of diapers would be dropped off here, and they came alongside of us with the meal distribution. And then the door opened for us with the diaper bank too. So she was really a big part of that. And actually she's who connected us with you guys too. So she's an awesome friend to us.
Well, there's a couple other questions in the chat, and I'll go ahead and read some of them out loud for you, if that's okay. First, was there anything that surprised you about what the moms said to you about their healthcare experience, about their experience with their healthcare teams? Was there anything that surprised you, or that
anything that surprised you that they shared about their health experiences,
pregnancy or postpartum?
Yeah.
The health.
And we can follow up on that.
Yes, Susan, you can write or something, because I don't know.
That's okay. We can follow up on that one.
Yeah.
The next one, we can follow up. That's okay. Is about how mothers want to receive their health information. So hearing more about what would be helpful. Is it more written materials, booklets, flyers? You mentioned videos.
Okay.
So
Yes. They love the information, because, for example, I have one mother, she have 5 kids and she wait to the sixth, and she have one kid is 23 years old. And she said, oh, I don't have that information, or that's so good, some things happen. She have a lot of experience because she have 5 kids, right? So, but when I start to show about the information, oh, I don't know that. So they love what I found in the page. That answered the question.
I'm on mute. Sorry. So the written, like the website and like the postpartum plan, the written materials worked well.
The what?
The written, if it's in paper, does that work well, or does the video work?
Yeah, okay. Yeah, and this is the other part of the question. Okay, sometimes I put sometimes ladies no can read, but it's good to see the videos. They very fun to they don't have idea how doing the computer, but they know to see the videos in YouTube or in TikTok. They love it. So, and sometimes, when no can read, but they can understand what they say in the video, they love the videos. So sometimes, it's better having the videos. Help a lot because, they can read well or no, have a good level for reading.
I'm just gonna make a comment. I got a chance to meet with Amelia earlier this week, and one thing I learned from her is just recognizing as healthcare professionals engaging with Spanish-speaking population, there's a difference between availability and accessibility. So we're doing a lot of translation into written materials, and Amelia had brought on the literacy dynamic is a particular issue to be concerned of, and that's why the videos are that much more helpful. And so that's something that we may need to think about is, yes, we can translate a lot of the materials to make it available, but is it really accessible? Is it being presented or delivered in a way that that the mothers are feeling comfortable to actually understand what you're trying to portray.
Yes, also sometimes, you know, when they go to the doctor and they not can talk or not have it, they not feeling confident to talk to the nurse or the doctor, but they come in and see the video. They feel, oh, I understand that, I can do it. You know, but sometimes they can explain to the people how they feeling, and they helping a lot when they see the video. They said that to me.
I think I also learned, and to that point, is just talking about some of the being mindful of some of the technical stuff that we have, you know, like just having access to data, having access to a computer or a smartphone even. I remember you told me a story of something, you're like, what year is that phone? I don't know if I have internet on there. And so being mindful of that. And also just mindful of, I use QR codes a lot, and perhaps, you know, that, or even hyperlinks, that can be, that could also be a barrier to access.
Yeah.
There's another question about, do you collaborate with the local library at all?
We do. They've been here. They have a mobile library, and they've been here. They were coming once a month, I think, when we had the Boys and Girls Club here, and then they've also come to a lot of events. And then we're doing a special, like a read-along thing for Hispanic Heritage. So it'll be in September here too. So yeah, they've been a great partner with us also.
Oh, if it answers Kristen's question. Check the chat. I don't think, does anyone else have any other questions for CityGate? I know we will plan on probably doing another community of practice in year 4 at some point, where we're talking more about the work and more about, you know, these mothers and some follow-up information out there. Say there's more. Are there any recruitment or evangelism done at your events?
No, we're our own nonprofit, separate nonprofit, and so we partner with a lot of different people. If we have something that's more like a faith-based thing, then it's clear that that's what it is, but it's not, you know, a part of the other things that we do. And now the church is still a huge support of what we're doing and give us about $100,000 a year. And then my salary is through the church. So prior to COVID, besides the city of Burlington, we really didn't have any outside funding coming in. But with us, the opportunities we had during COVID, we've gotten a lot more opportunities. And then we did, I guess 2 years ago, became a United Way sponsored charity too. So we've just had a lot of different other things. The great thing is, like, through the meals and then doing the vaccine events and all of that, last year was a lot of people contacting us saying, hey, we want to work with you. We have this money. We'd like to do this. So, and we've gotten to grow incredibly because of that.
Somebody asked, are the health topics, do you think are most, okay, with Christy truly, okay, that question, yes, for the mothers. I think we can have a videos or doing videos how fit to the kids, you know, because they thinking is get sweet things when they are little ones, you know. So I think having more videos about how can fit to the kids. I said right, how fit the kids, because they thinking, for example, they give first to the fruit, the little Gerbers or something is fruit. They thinking they help to the kids, but I think it's better to the vegetables or something like that, you know, something help to the mothers. How can help the kids have a healthy. So that I think is good idea.
Yeah. We've done diabetes prevention classes in the past too, and then we have some other fitness classes. And then through the women's empowerment group, they've been addressing different aspects of healthcare too. And so we're really just trying to listen. If there are things that come up in conversations, then we have some great partners that we can get resources from too.
And I want to note, we do have a video series coming up, so that's really important. I'm so glad you're sharing that. We are creating an animated and a TikTok style video series. It's coming up hopefully this fall or this winter. So we will hopefully be collaborating with you on topics and on, you know, how to cover this well and how to cover it for, you know, especially for your community, the topics they'd want to hear and how they want to receive it. So that's in process right now. So I'm excited that it kind of matches what you're saying about the videos and about, you know, healthy eating and healthy topics. So thank you so much for presenting. Thank you, everyone. My last couple announcements. I'm going to, if we could put the evaluation link in the chat, if you wouldn't mind sharing what you thought of this session today. Also, like I said, for future events, we're in the works of planning our year 4. Hopefully we can have CityGate Dream Center come back and share an update on these videos and on the postpartum care plan, which is almost final. And just also a note that all of the postpartum toolkit materials are currently going through PA2 review by DPH. So hopefully by the end of the year, everything will be orderable. So you can order those postpartum toolkit materials. So that's really exciting. Our next office hour is September 12th at noon. And that's where we're going to be talking a lot about year 4 and about topics. We're hopefully just going to be listening to also a lot of, you know, kind of what you want to see in year 4 and topics and things like that. And then our next community of practice will be in October. All right, well, with that, I'm so grateful for everyone for joining. Please do submit that evaluation, and then we'll see you on September 12th. Bye, everyone.